后行是什么？照影看过了吗？屏幕往这边再拉一点，不是机器，对，再侧一点过来，对，转一点过来，往这边，嗯，血流，血流，这是复发的是哪里转移？Time out.
Before the surgery, the surgeon will start a timeout with the nurse, and Professor Huang using the color Doppler to check the ablation track is safe or not. And this patient is colon cancer with liver metastasis. So it's going to perform a microwave ablation.
没关系。照影做了吗？不用做吧。
The ablation
照影做一个，看一下。
and Professor Huang is going to have a contrast enhanced ultrasound.
So before ablation, normally CUS should be performed to assess the vascular culture and the feeding vessel using CUS. 3、2、1，开始。Now the agent start inject, and we start to active the timer and to record this video. So this is laser planned with a heater enhancement on the earlier telephase. And this is ablation zone, which had already performed several years ago. And this is new recurrency lasers with rapid washout in the later phase. And we will measure the size of these lasers. Based on the size, we can consider the duration time and the power of microwave. 好，切换吧。摆进去。 we use freehand technique.这里内间隙没有啊。And adjust the direction of this microwave electrode, insert into these ledges, and beyond these ledges, and okay, we can find the 可以开始了。Now the microwave start work. We can find the developers covered the whole ledges field. Based on the size of this tumor, the maximum diameter is 2 centimeters in diameter. So normally we need to have a lasting for 4 minutes enough with 70 power X power. 这怎么会抖起来？后面是已经往前冲了很多了。可以了吧？等一下会有点痛。啊，不管。4分钟够了吧？ Okay, finished this ablation procedure. 好了吧？好了，下一个做什么？啊？OK，
下一个是甲状腺癌消融，主任。
三个，细针呢？细针这两个也行啊啊，这么简单？是我这签字的，这个不是我。
Professor Huang, can you hear me?
Yes.
Maybe we can use this time for a small question.
Oh, yeah.
So if anyone have questions or insights, are welcomed during this time. 国内的老师有什么问题吗？可以请教我们黄老师。
是不是全麻的？他这个前面烧到腹壁的话，会不会有疼痛感？
我们全
全麻的吧？
对。
哦，好，哦是，就这个。
So this is a general anesthesia applied for this patient.
Thank you, Professor, for this video. I would ask about the duration for the process. To what limit you know that the microablation actually complete finished? So what is the exact duration? Or is that there is a standard for the duration process for this ablation, or just is under your personal estimation?
So this is a good question. So normally we should have a preoperative assessment before this ablation. Normally we should assess the feeding vessels and the size and the location. And based on these situations, we should make the management make decision considering on the power and the duration time. And we ensure to completely ablate it. So for this case, we just using the 70 power of the microwave uh, export and the duration time 4 minutes. They'll have a reference, and the first we should focusing on the feeding vessel for this this liver cancer. We should block this feeding vessel, and which may reduce the heating sink, and will which expanded the effect of the ablation zone. 谢谢马瑞老师，辛苦了。
Okay, Professor Huang, I have a small question.
Yes.
In which situation should we choose to do the CUS during the operation or after the operation immediately?
Yes, before ablation, normally CS should be performed to assess the situation of the tumors, including the feeding vessel and the adjacent tissues and the surrounding vessels and the size and whether do I have any another satellite nodules can detect based on the CUS features. Normally, the malignant satellite nodule will be planted with a rapid washout in the late phase, so which may be high sensitivity than the B mode ultrasound to detect the satellite lesions. I think this is very important. And after the ablation, because most of the lesions will be have weapons, which will be affected the CUS. So we should have CUS after the ablation, 1 day after the ablation. So tomorrow the patient will be rechecked using CS to confirm whether the ablation zone will be big enough to cover the whole lesions.
Okay, thank you.
So I will introduce the second patient's history. So the second case is a 47-year-old female who found thyroid nodules for 3 years.